Very much for a lovely introduction, but I must say that us here in Cork do absolutely the best work across all areas, and like that. So I suppose the idea around engagement and retention came from my previous experience of working in Cork University Hospital, and we've seen that this big issue of how do we actually engage and retain them. So I worked with patient and public involvement individuals from the Cancer Trials Unit in UCC to actually develop this proposal. So I'm a student with the School of Public Health, and I'm under supervision of Professor Frances Shiely. I suppose the background on the topic, like most of us know, PPI is research that is done with or by patients, and it's not to do it to, about, or for them. We know that it offers numerous benefits, that it improves relevance, quality, and credibility of research, which then leads to more applicable findings. However, current literature really lacks a clear understanding of different factors that then facilitate this engagement, enhance retention, but particularly in the context of cancer trials, I think the idea of complexity, as it was mentioned today, can really be seen then as well when PPI is being applied. So with that, we hope to, I suppose, resolve this issue around engagement and retention by carrying out the following 4 studies, which first being the scope review that's currently ongoing and it's in its final kind of stages, but it's looking to explore the engagement and retention. So we're looking at different engagement and retention methods, whether demographic characteristics are being reported, what are they, and the different factors, I suppose, that affect it. We also have a cross-sectional survey currently open that is looking at the demographic characteristics, and we're also looking at the different engagement and retention methods. We hope then once we have these results that it's going to inform our qualitative interviews, because we want to look more in depth at the experiences and different perspectives once we do identify, I suppose, what are the challenges. And we will, I suppose, tie it all in by conducting focus group discussions, because we want to look at different training and supports that are needed for both researchers and PPI contributors in terms of cancer trials. I suppose I want to give a bit more information on the 2 studies that we do have ongoing. So, like I said, the scope and review study is currently in the final stages of data analysis. We followed the JBI framework, and I suppose we included all papers that involved and engaged individuals in trials. We didn't, I suppose, exclude papers that didn't specifically mention PPI, which was a good thing because only 48% of papers mentioned PPI. So there's a lot of different ways of engaging. We started with just over 9,000 studies, and 131 were included in the review, and 98 being included in data extraction, because 33 studies only reported PPI but provided no further information. Some of the engagement methods we have identified, so having introduction sessions and the idea of onboarding is really important. There's a sense of unknown when it comes to PPI, so they like to have idea of roles, expectations, what's actually going to happen. What was mentioned already today, early involvement in the study, so involve them from the onset. They want to be part of creating the study, the idea of what is actually important. Like Mohammed mentioned, planning for PPI, having the actual plan. I think we all underestimate how much time, effort, funding it takes to do PPI, particularly in trials. As we all said, trials take time. So it's really important to plan how we're going to engage and retain them. Like I said, discussing these roles and expectations, really important. And then having structured meetings. So these regular recurring meetings that have some sort of structure, agenda sent beforehand, knowing what's going to happen. Demographics reported by very few studies, about 20-something, but we can see that it's predominantly females with 68%, followed by male of 32%, and we had just 0.01% of transgender. Education, again, mostly higher degree and education with 63%, and mean overall age was 54 years, and we had ethnicity really varied, but we had 10 studies that reported only white, 7 only ethnic minorities, and 10 that had multiple. And last is the survey that's currently live. As like I said, very limited data. There have been no previous surveys that I looked. We had brilliant recruitment. We aim to have 100. We have 200, and it was designed with PPI contributors, and it's closing in December. I'm totally out of time, so that is everything, and I'll take then questions later on. Thank you very much.